also support the AfriChild Center in the aspect of research coordination. So you are most welcome. Thank you for making time for this webinar. This is the second of our webinar series for this year. And today we are privileged to host the team from Makerere University, represented by the principal investigator, Dr. Kamisi Musanje, whose bio we are going to run through at some point. So basically, to take us through the agenda for this day, we basically have a few remarks, welcome remarks, where we are going to share more about the Inter-University Child-Focused Research Methods Training. And then we shall have the introductions, where I will run you through our speakers of the day. We get to know who is going to speak to us, and then we shall have Dr. Kamisi present to us. Our topic today is the behavioral problems associated with internet exposure among children in Kampala. Then we shall have a discussion from Dr. Scholastic Ashaba from Makerere University of Science and Technology, who will basically dismantle the topic for the day and share more insights. Then we shall run a poll to have you participate and share your feedback and your experience regarding the topic that we are discussing today. We shall have a Q&A question where you will have a chance to ask any questions or to make any comments. And then we shall close this webinar with some communication regarding the following webinar that we shall have in the month of April. So you are most welcome. Feel at AfriChild, feel free to share all your comments in the chat. And I invite you actually to introduce yourself in the chat and also give us some bit of detail of where you're joining from, where you work from, all those for us to get to know who is joining us today. So my name is Maria Ndibalekera. Just to share a brief about the Inter-University Child-Focused Research Methods Training, from which we are hosting this webinar from. Some people might be wondering, AfriChild and then Makerere University. So briefly, the Inter-University Child-Focused Research Methods Training and Mentorship Program is one of the flagship programs run by the AfriChild Center. This program is intended to strengthen capacity of faculty members from now 10 universities to undertake child-focused research. They are already researchers, but we are interesting them to now pick interest in child-focused research. You well know that majority of our population in Uganda and maybe even in Africa are children, but there are few people who are taking interest in studying about child well-being issues. So that AfriChild Center designed this program to specifically train faculty members from universities to undertake child-focused research. Currently, the program has Makerere University, Chambogo University, Gulu University, Muni University, there is Uganda Matters University, Uganda Christian University, Islamic University in Uganda, Insamizi Training Institute, and we also have Addis Ababa University in Ethiopia. For the fourth cohort, the center is actually looking at expanding this program to have other universities join in from Africa, that is University of Rwanda, University of Dar es Salaam, and University of Nairobi. So before you know it, we shall be covering the whole of Africa. So I want to welcome you with that brief about the universities that are taking part. At this juncture, I want to welcome the comms team to also present to us the video about the center for you to get to know more about the AfriChild Center. Thank you. Comms team, over to you.
Welcome to the AfriChild Center, where we strive for an Africa where children's well-being is realized for sustainable development. The AfriChild Center exists to generate research that informs policy and practice for the well-being of children.
Established in 2013, the AfriChild Center exists to improve the lives of children across Africa. As an institution, our vision is to see an Africa where child well-being is realized for sustainable development. We recognize that across Africa, and specifically sub-Saharan Africa, children continue to face challenges across the domains of child health and survival, child protection, child development, and child participation. And as an institution, through research, our mission is to generate evidence that will improve practice and policy. We do this through rigorous research, capacity building, with an intention of building a cadre of researchers across Africa that will contribute to generating evidence to improve both practice and policy. But we are also intentional on our engagement at policy level, ensuring that research is undertaken with the intention of improving our legislative and policy frameworks. We are keen on partnerships. We believe that we cannot do this alone. We need to work closely and in collaboration with like-minded organizations, with partners, communities, and more especially with children involved in echoing and sharing the aspirations and the vision.
Join us in our mission to transform the lives of children across Africa. Together, we can make a lasting impact. To learn more about the AfriChild Center and how you can support our work, visit our website or follow us on social media.
Thank you so much, Comms team. I believe now everyone that is joining us today is well versed with what the AfriChild Center is and the work that it does. So at this juncture, I want to introduce our panelists of the day. Comms team. Okay, our panelists for the day, we have Dr. Kamisi Musanje. Dr. Kamisi Musanje is the principal investigator for the study that is going to be presented to us. He's a behavioral scientist with a PhD in health sciences. He's also a lecturer in the School of Psychology at Makerere University in Uganda. And he also serves as a senior social scientist with the Makerere University John Hopkins Research Collaboration, MUJU. You're most welcome, Dr. Kamisi. Our discussant for the day is Dr. Scholastic Ashaba. She's a medical doctor. As you can see the credentials, she has a bachelor's degree in medicine and then she's also a lecturer in the Department of Psychiatry at Makerere University of Science and Technology in Uganda. She's skilled in program evaluation, lecturing, public speaking, healthcare, and clinical research. She's a professional with a Master of Medicine in Psychiatry from Makerere University in Uganda. And she also has a PhD in HIV and adolescent mental health from Makerere University of Science and Technology. Dr. Ashaba, you are most welcome. We are glad to have you discuss and share your expertise, especially in the area of mental health, with us today. Now that we know our presenters for the day, at this juncture, I want to welcome Dr. Kamisi to take us through the presentation. Doctor, over to you.
Yeah, thank you, Maria, for the kind introduction. Good afternoon, good morning, and evening, wherever you are based. We welcome you to this webinar. It's a very important and interesting webinar about the behavioral problems associated with internet use among children in Kampala. This was a study funded by the AfriChild Center as part of the inter-university training, and it was done by the Makerere University team, which I lead as the lead investigator. But we also had colleagues. We're working with Dr. Simon Matiga, then Dr. Douglas Abati, Mr. Rogers Namuyeli, Yori Rakasole, Dr. Bernadette Nakabazi, Dr. Lev Maseleka, who are also being mentored by Dr. David Onen and Dr. Deborah Ojambo. So that is the team that did the job. So while I'm presenting, it's not solo effort, it's a team effort. And I have also seen some of my colleagues online, so I feel it's nice having them around. So what exactly do we do? In this study, we focused on the behavioral problems that we associate with the excessive use of internet among children in Kampala, specifically primary school children in Kampala. We operationalized behavioral problems as disruptive patterns of actions that interfere with the child's daily life and formation of relationships. And these behavior problems can be broken down into internalized and externalized. So we also operationalized internalized behavior problems as emotional and psychological struggles a child faces, but they are directed inward and often manifest as anxiety, depression, or withdrawal. We looked at externalized problems as those which are outward directed, and most times they violate social norms, behaviors such as aggression. Then we operationalized severe internet use as excessive online behavior that gets in the way of a child's life, sometimes disorganizing a child's responsibilities and relationships, and often characterized by too much obsession with screen life over real life. So having that in mind, we acknowledge that due to the popularity of affordable mobile devices today in Uganda, we realize that internet has now spread to almost all corners of the country. So while the adults are enjoying excessive internet, mostly powered by mobile services providers, the children are also increasingly getting exposed to internet in Uganda. Research shows that exposure to internet among children is good for their cognitive development. It helps them with educational achievements. It's also a form of entertainment, but it is also presumed to trigger social and behavioral problems among children. So as we note that our children are growing up in an advanced digital society, and we celebrate the benefits that come with it, we also take note that too much exposure is presumed to problems. So not many studies have been conducted to explore this relationship, the association between internet exposure and behavioral problems, so that we can guide intervention developers or even policymakers on what we can do for the benefit of our children. So in this particular study, we set out to investigate how behavioral problems what behavioral problems are associated with internet usage. And we settled for children, school-going children, in the ages of 10 to 14. So we were recruiting from primary schools. Specifically, we were led by 4 objectives. Objective 1, we wanted to understand the prevalence of the behavioral problems among children and also look at the associated factors. Then we also wanted to analyze the severity of internet usage to understand how much do they use. Then we also wanted to see the association between those two, the internet usage and behavioral problems. And lastly, we wanted to explore and understand the usage patterns. With the usage patterns, we paid more attention to what exactly do they see on the internet, how frequent do they use the internet, which sites do they visit, and what are the perceived risks from the child's perspective. So to be able to achieve those objectives, we conducted a concurrent mixed method study, meaning that we're collecting both quantitative and qualitative data, but collecting it at the same time. And we did this study among 476 primary school children, which we routed from 4 primary schools in Kampala. We engaged 3 public schools and 1 private school. So in collecting the data, we used the survey, also used in-depth interviews with children, and also conducted child-friendly focus group discussions. This study was approved by the Makerere Research and Ethics Committee and the Uganda National of Sciences and Technology assent before we commenced. So the study was ethical, and everything was done between June and July 2025. So in the survey, we used a very famous tool in collecting data. It's called the Youth Self-Report. This tool was developed by the ASIBA group, and this tool is organized into 8 syndrome scales. The 8 syndrome scales include the anxious, depressed, the withdrawal, depressed, somatic complaints, social problems, thought problems, attention problems, rule-breaking behavior, and aggressive behavior. In using the Youth Self-Report, the 8 syndrome scales are then categorized into 2 problems: internalizing problems and externalizing problems. So under internalizing problems, we look at anxious, depressed, somatic complaints, and withdrawal. And then for the externalizing, we cover rule-breaking and aggressive behaviors. Then both internalized and externalized are then combined to create what we call a total problem score. In scoring the Youth Self-Report, we use a recommended threshold whereby any score below 60 is considered normal, any score between 60 to 63 is considered borderline, and anything above 63 is considered clinical. But for this particular study, we captured borderline under clinical, and therefore moved the threshold 60 to separate the normal and the clinical. So any score that was below 60 was considered normal, and any score that was above 60 was considered clinical. We did this because there are several studies that have actually done this and recommended it, particularly for diagnostic purposes. Then for understanding internet usage, we use the compulsive internet use scale. It's also a very popular tool, and its scores range from 0 to 56, with 0 to 20 representing normal usage of the internet, 21 to 28 representing mild, and any score above 28 representing severe internet usage. When it came to analysis of the data, for the quantitative data, we used data version 15 in analysis. We did descriptive analysis to determine the prevalence, then also did Pearson's chi-square and the logistic regression for both associated factors and also in understanding the relationship. Then we conducted thematic analysis for the qualitative data that were collected from a selected group of children with the support of Atlas TI, which is a qualitative analysis software. Here are the results. First of all, painting for you a picture of who we involved. Okay, we realized that most of the participants were female in primary 6. They were between 12 to 13 years, and they were Christians, and they were attending private schools. So that is the image, or that is the best of the group that we engaged. So starting with results, remember objective 1, we wanted to understand the prevalence of behavioral problems among children. So as you can see from this slide, the total behavioral problems among children stand at 64%, okay? Stand at 64%. And when we go into the symptom scales. Actually, before we go into the symptom scales, we realize that the total problems stand at 64%, but our children in Uganda present more of internalizing behaviors as compared to externalizing behaviors, essentially meaning that they orient inward, because 74% reported internalizing problems. When we get to the behavioral symptoms, we realize that anxious depressed was highest at 72.6, followed by withdrawn depressed, and then somatic complaints. Somatic complaints mean lack of sleep or challenges with sleep. So from this slide, we can understand that behavioral problems are prevalent among children, primary school children in Uganda. So this is a sample of how the youth self-report is interpreted. We do this for every child and then work out the totals. When we look at the factors associated with behavioral problems, we know now that the behavioral problems are variant. So what factors are age, class or grade in school, and religion? Then plus the nature of the school the child is attending. So you can see from the results that gender, age, class, and religion were all associated with behavioral problems children face. So you realize that the only factor that did not have any association with behavioral problems was the nature of school. Regardless of whether the child was in a private or public school, they still exhibited behavioral problems. So that is important to note. Then when we continue with the risk factors still, we take note from the multivariable analysis that if we look deep into age, older children reported more clinical aggressive behaviors. We see ratios of 2.17 and externalizing problems compared to the young ones. Also, children aged 12 to 13 years experienced more clinical total problems compared to other age groups. Then gender. When it came to gender, males had higher levels of clinical anxiety, stroke depression, thought problems, and rule-breaking behaviors compared to females. And when it comes to class in school, children in primary 5 and primary 6 reported higher clinical levels of total problem compared to children in other classes. Then when we moved on to result 2, which was about looking at severity of internet usage. So if you look at the slide, you realize that most of the participants, most of the children that participated in this survey reported severe internet usage. That is 68.3%. So your children are severe internet users. We tested out factors which were associated with internet usage. And as you can see from this slide, gender was associated with internet usage, religion was associated, and then the purpose of using the internet, gaming and entertainment was also associated with a severe internet usage. So when we did the multivariables or the multivariate analysis, we take note that male children or boys report more severe internet usage compared to girls. If we look at the odd ratios, 2.05. And then Muslims were less likely to use the internet compared to Christians and others. And then children who use the internet for entertainment and gaming devices were more likely to report severe usage, 5.26 times more than those who use internet for other purposes. This is powerful. And so when we moved on to objective 3, which more or less covers the main thrust of this study, behavioral problems and then internet usage. Apart from somatic problems, all other behavioral symptoms and behavioral problems were associated with severe internet usage. You can see that anxious depressed was associated with severe usage. Withdrawal depressed was associated. Social problems were associated with severe internet usage. Thought problems were associated. Attention problems were also associated with severe internet usage. Same applies to rule breaking and aggressive behaviors. So that's for the behavioral problems. And then when we go to behavioral categories, where we have internalizing, externalizing, and total problems, if you look at the p-values, they indicate that all the behavioral problems were associated with severe internet usage. So this means that the more they use the internet, the more they are exposed to these behavioral problems. And we should take note that these behavioral problems affect a child's growth and development. So we moved on to the final objective of this study, which was about the internet usage pattern. Here we were interested in letting you know how often do they use, which content and which sites do they visit. Now, starting with, we asked children what was helpful content or what was appropriate content that they were getting exposed to on the internet. They told us that they use the internet to access education content. As we have a quotation here from a 12-year-old male who says that I go and search about mammals. They tell you, they show you the pictures of mammals. So then they also told us that they use the internet for entertainment. We watch some good movies, for example, like The Miracle Child. That's an 11-year-old female. Then they also told us that they use the internet for communication. And someone says here, I like using it to chat with my mom, dad, and friends. That's a 12-year-old female. And others told us that they use the internet to check out products and prices. If you need glue gun, you search its price. That's an 11-year-old male. Then when we ask them what is unhelpful or inappropriate in their own perspective that they see on the internet, your children told us that they see sexual materials. We have here a 12-year-old male saying there are people who search for sexual activities, people who have no clothes. Then a 13-year-old girl told us there is violence. The 11-year-old male told us that they are exposed to abusive language, particularly on TikTok. Someone can hear abusive words and come and use them in class and spoil others. And since we are using child-friendly approaches, you could see on the right side, those are dummies we cut out for them, and they were writing things they see. So you can see fighting, early marriage, abusing, then we're seeing sexual activities, naked people, bad fiction, night dancers, bad songs and bad movies, and then romantic movies. Your children are watching all that on the internet. Then we ask them about duration. How long do they stay on the internet, and how frequent do they use the internet? They told us usage is mostly 1 to 3 hours. A 14-year-old male told us, I just use it for 1 hour. After 1 hour, I stop. I spend some time with my friends. Then they also told us that usage is highest on Saturday. A 13-year-old female told us that Saturday is my free time when I go and I get my laptop. Then they also told us that usage is for educational purposes. Usage at school is for educational purposes, and usage at home is for entertainment. So someone here says, Thursday we go for computer lessons, okay? Then on Wednesday we go for ICT. That's a 12-year-old female. On the right side, you can see the child-friendly approaches, children showing us how often they spend, how long they spend on the internet. Then we ask the question about access. As you're enjoying this internet, how do you access it? Majority of the children told us that they access the internet through the mother's phone. My mother's phone, she gives it to me to use. That's a 13-year-old female. Others even own laptops. So we have a child here saying, so I get my laptop and I help them. I help them make crafts. I teach them. I play games. Then they also access internet through the mother's laptop. My mom gives me her laptop so that I can refresh my mind. Okay, then others even own phones. They use their own phones. Children have phones and they smuggle them, even in schools. That's feedback coming from your children. Then we put interest in the internet sites. We ask them, which sites do you often visit? So the most commonly visited sites were TikTok, WhatsApp, YouTube, and Facebook. So we have a 12-year-old male telling us, you can search Miracle Center Cathedral on Facebook, and it will show you the videos and what's happening. Then I asked that YouTube and Google have the same function. Then they also use ChatGPT, that is AI. So someone uses AI to do research, and they can even make their own videos using AI. Others use Google. On the right-hand side, you could see that they even had a recall of the icons that represent these particular internet sites. Then, as we edge closer to the end of the talk, we ask them about perceived risks. Which risks in their own perspectives do they think are associated with internet usage? First, they told us it has physical challenges. In here, they say, watching for so long causes eye disease. It makes your eyes red. Then they also told us internet creates lack of concentration. At times they were reporting passive. For example, we have someone here saying, some children are already thinking about the internet and don't understand what the teacher is talking about, like they are not concentrated. Then they also noted addiction. And we have a 13-year-old female saying, you don't have to use the internet. You don't have to use the internet at any time, because sometimes when you use it, you can become addicted to it. Then finally, part of the perceived risks involve learning inappropriate behaviors. People follow others' cultures. Like, for example, when a child sees somebody who has pierced his ears, and also he wants to copy and also causes problems. That's a 14-year-old female. So children, new risks associated with internet usage. In conclusion, we take note that the usage of internet remains high among children in Kampala. And also the behavioral problems were high, reported at 64.8%. Yet a clear link between internet usage and behavioral problems has been identified by this study. So, while we take note that internet usage is central to learning, and we want our children to learn, to grow up in the digital age, we should also be mindful that a lot of unfiltered and age-inappropriate content is being passed on to children. From the study, we take note that boys and older children showed more clinical behaviors and also showed more severe internet usage. So that can be a good population to pay attention to. And there weren't variations between experiences in public or private schools. So you cannot afford to say mine is safe because he's attending a private school or a public school. There were no differences. So we make the following recommendations. First, we think screening of behavioral problems among children, particularly in school, should be encouraged so that earlier interventions can be provided. Then two, we call on parents to regulate internet usage. Children told us that most of the unregulated usage is at home. So parents, please come up and regulate internet usage for your children because you've seen that it's associated with behavior problems. Then schools should also be deliberate and offer psychosocial support to children because behavioral problems are prevalent. Then males should be prioritized as they reported more clinically significant behavioral problems than females. Then finally, sensitization to create awareness among the public about the consequences of unregulated internet use and the prevalence of behavioral problems among children need to be intensified. This is the only way we can win the fight together. So I wish to acknowledge AfriChild for funding this study. I want to acknowledge Makerere University, our mother university. I acknowledge our mentors, Dr. Deborah Ojambo and Dr. David Onen, who did a significant role in shaping this study. I also shout out our Masters of Counseling students who worked as research assistants in collecting data. I also want to acknowledge all participating schools and the children who provided us with the data. Finally, I want to acknowledge all the cohort 3 participating universities that we worked closely with in shaping our study. Thank you so much, Maria. I now pass over the microphone to you.
Thank you so much, Dr. Kamisi, for such an elaborate presentation. I request that we give him some emojis to appreciate him for the wonderful work that he has done. I believe we are now all well versed with the internet usage among children in Kampala, as well as the behavioral problems that are associated with the internet usage. Thank you so much, Dr. Kamisi. It's been so elaborate. What has struck you as a person who is participating in this webinar? Many things have struck me. On my end, I'm shocked by the fact that many boys are the ones that are being affected, especially they are the ones that are getting the clinical problems because of access to internet. I don't know how much attention we give to the boy child. Many studies out there usually focus on girls, but probably now it's time to also focus on the parent there. How are you protecting your children? The mothers, the children say that access through mommies. We also are giving our phones to our children access internet. It's very elaborate, and we got to know the sites where to go. So probably this eye opener of how we can monitor children, maybe support them while it has advantages, also has those challenges with it. So at this juncture, I want to hear from you, my lovely audience. We are going to run a poll just to get to hear from you. How are you protecting your children currently? And what behavioral problems have you also come across as you interact with children? And as we run the poll, I also encourage you to post all your comments in the chat. As they come in, we shall also get to them, and we will also give you a chance for you to speak us at some point. So at this juncture, I want us to first run the poll and to hear from you. I hope that poll has come through to screen. We are basically responding when children in UK are online, how often are they on their own without guidance? Just be honest to the mothers who are part of this webinar. Just be honest and respond. The second question is, since we're spending more time online, we have seen, what changes have you noticed the most among children? Okay. Thank you for indulging us and for participating in the poll. Our responses are: for question 1, what we are seeing is that which is focusing on when children in your care online, how often are they on their own without guidance? The majority are saying sometimes, that is 41. The dominant number is saying that 40, sometimes they're on their own without guidance, 41. But then also have those who are saying quite often, that is 24%. And then almost all the time, they are on their own without guidance, that is 14%. So we can see that for a larger majority, there are times when children are on their own without guidance. And being solution-oriented, maybe we need to think of how we can protect children. And then for the second question, since children started spending more time online, changes the most, and we can see that the behaviors that we are seeing as the audience, that children are getting irritated and they get angry more easily. They struggle to stay focused. A good number of us have shared that that children struggle to stay focused. And then they themselves more, meaning than to share with us what they are seeing. So you might think that maybe my child is learning, but maybe they are seeing romantic movies and they keep it to themselves, they won't share. And then lastly, their patterns also change. So these are some of the things you can also try to explore with your little children at your home or in your neighborhood and see how they are behaving, and maybe you see how to protect them. So thank you so much for participating in the poll. Very good responses out there. Okay, so now at this juncture, I want to welcome our discussants, Dr. Scholastica, to take us through the next session of the webinar. Doctor, over to you. You are muted, Doctor.
That's bad. Thank you, Dr. Kamisi, for the presentation, and thank you, Maria, for moderating this. Let me put on my system because I can't see all without them. Okay. So as I listen to this presentation, it's sometimes too hard to take in. And what was so difficult for me is that the parents are the one giving the children the laptops and the phones and so much more. But the question is, when the parents give these gadgets to the children and then the internet is free, do they know what the children are doing? So for me, I think we as parents, we are responsible for what is happening to our children. One of the things I think Dr. Kamis said, or they found in their study, was when I go home, my mother gives me the laptop so that I can relax. Since when did you start relaxing on internet and social media? That becomes very difficult, right? So I start by saying that internet came and social media came. Both of them came for certain reasons, but we are misusing them. If we cannot tell our own children what to do, if you give your child a phone, what is the purpose of a phone? And most times we don't say that. What we do is that you give your child a phone, internet is free. It is also free in my house, where I am. So anybody can access, whoever is in the house can access. But what are we accessing internet for? And what social media, what are we accessing on social media? TikTok, children are on TikTok, children are on YouTube, children are on other things that I may not know. So there's the Instagram and other things. So there are many things that our children are likely to access on internet if we don't tell them what they should make use of. And I think most times we as parents, we are not doing that. And you found that everybody is pretty much affected. So I wanted to go back to the results. You found that children who were depressed were actually more at risk of using internet. And let me tell you, it's not the internet causing it. Rather, it is not that they are depressed. It is because they are depressed because of the internet and excessive use of social media. So when they start using it, they are socially isolated. They don't have friends anymore. The friends are people, what they call fans on internet, and those are the people they call friends. So before you know it, they are socially isolated. Before you know it, they are depressed. The more depression, the more social media use. And nobody's paying attention. Even when they're socially withdrawn, nobody's paying attention. Because, hey, we are giving our children our laptops and our phones and maybe buying them phones so that they can relax because they have left school so they can relax. I think, as the children said, that some of them use it for, I think, education. Yes, but what are they looking for as far as education is concerned? Children are not guided. I understand, I'm not on TikTok, but I understand when you go to TikTok, you click on one thing, they keep giving you more information of that. So how long does a child actually spend on the internet, on social media? Even when they say it is 1 hour, I think it's a little more because the children may not tell us the truth. This is research, so they will say something that can make sense, that can be acceptable to you as a researcher. So, and then you found that children with externalizing symptoms were fewer in school, and the reason being that if a child has externalizing symptoms, those conditions, things like conduct disorder, opposition defiant disorder, they are not going to be in school. So those you couldn't find them in school because probably no school can accommodate them and the parents don't know what to do. So they are labeled difficult children and they are left in the community. So you're not going to see those. But the question is, where did it start from? Is anybody following up on those children to see what went wrong? And sometimes not. So for me, I think they said there's lack of concentration, there is rather learning inappropriate behavior, and then of course physical challenges, but all these things is called the addiction. The children are actually getting addicted to internet and social media because these things are available and they are not guided. Children are becoming difficult because they are learning certain things, but I'm going to say more about depression. So I said it's not that I could be depressed and then I focus more on the internet and I'm socially withdrawn and people think I'm busy. But also I could spend more time on the internet and social media and I learned to be alone. I learned to get my company on social media and I forget that people exist. So I lose friends. I'm alone. I'm isolated. And because nobody cares, I also get depressed. But the challenge with depression is they can actually commit suicide because what they are watching, they begin to watch what makes them feel good in that state. And what makes them feel good is other depressed people. So the other depressed people are discussing on how to end their lives. And then these children can actually do something like that because they have learned, someone who was feeling the way I feel, they did something, let me end it all. And that's when it becomes dangerous and nobody is watching. Yeah, so physical challenges, yes, but more the addiction. Because all these other things become because a child is addicted to the internet and of course social media, but nobody is, guiding these children. So okay, I'm glad that somebody has done a study so far that we can actually publish this research, that the world can see that at least in Uganda, this is what is happening to the children. Because even when you give a phone to a child and say, hey, for learning purposes, are they actually learning? Or they're actually deviating from the learning, from the purpose they went there to do some other things that make them happy beyond the education, right? And this was a study done among young adolescents, the 10 to 14. A very dangerous period, a very dangerous developmental stage. This is the time when these young people are beginning to find themselves. It's a time when they are beginning to look for peer support. So they want friends, they want to fit in. This is the time when the parent is never a friend. What you're telling me is actually not what I want, right? So And this is a dangerous time for a child to be on internet, to be on social media, because they feel like this is where I feel. So they start getting what they call friends online. And what are they learning from the friends? And they are consuming a lot of things, as I heard, very, very dangerous things, learning inappropriate behavior, seeing people naked. The child's brain is not able to understand and interpret that. And with time, that becomes overwhelming. And when it becomes overwhelming, that's when we see these externalizing symptoms coming through. They get conduct behaviors. The doctor who presented was saying they don't follow rules. Yes, they don't follow rules because conduct disorders, you against anything that fits into what anybody is telling you. You run out from school, you can't stay in school. Same applies to opposition defiant. They don't follow rules. They follow the opposite of what the world or the country or the school or the home expects them to do. And once they are on internet at that on social media at that age, it's hard to turn them back because their brain has consumed what they cannot revert. And they feel that is the way to go. And that's how we end up with children running out of school. That's how we have children committing suicide. And that's why we have more children abusing substances. Because this is the age when exposure is important, when peer pressure is a challenge, when they want to fit in. And so add social media onto that. When you add social media onto that, you no longer have a child. We no longer have children in school. Or we have children in school because the parents are forcing them to be. But maybe they have lost the purpose. So why are they in school anymore? And that's when you begin to see those externalizing symptoms. I'm not saying internalizing symptoms are okay, because depression is very dangerous as well. So either way, are we monitoring the child? We as parents or teachers, are we monitoring to see what the children are actually watching? But also when the children are home, are we aware of what they are doing? Are we watching their behaviors? Because we have to be keen. We have to be keen and know our children, because sometimes we don't even know the personalities of our own children. So to the parents, know your child. If you see some change, then check what is going on. And most times it's because they upon something more interesting. And this more interesting can actually turn out to be very dangerous. But if somebody is keen enough to see, the children can be treated and the addiction could go away, because as much as we are fighting against substance use addiction, internet addiction is the worst that is coming for us. And it's not for fun. I wouldn't advise a parent to give their child a phone to relax. Why can't you do some exercise? Why can't you run, get out and do something physical? Why don't you talk to your siblings and, talk to someone instead? Not the internet for relaxing. In the qualitative, a child said, I watch movies. Is it one movie? Because most times these children don't sleep as long as internet is free and they have a phone. So one movie turns into two and two turns into 6 and so much more. And the child is sleeping at 2 a.m. And of course, as we psychiatrists know, lack of sleep can cause depression, but also depression can cause lack of sleep. So if you're not keen, you're not going to know what is causing what. And I think I'll summarize it at that, but I wanted to look at the recommendations. The recommendations are saying that we should be more keen on screening. Why are we screening? Why can't we prevent? Instead of waiting to start screening, hey, are you having depression? It's because you're using a phone for much longer. Why don't we prevent before it happens? Well, when it has already happened, we can screen. But let's aim at preventing children getting worse. And I agree, we need to regulate how children are accessing the internet and social media. And the boy child. Nobody cares sometimes, but I'm a boy mom. So caring, all children are the same. The way boys are going to be affected by social media is the same way girls are going to be affected by social media. So all our children, monitor them and advise them and tell them about the dangers of internet and social media use. I think all of us who are in the meeting, we have checked on our phones several times, meaning all of us are more like addicted, right? So we start with us as adults. How are you using social media? How are you using phones? It is from there that we are going to advise the children on how best they can handle that. But most times we are not even paying attention. 11 hours you're on your phone, scrolling nonstop, and yet you're not scrolling for any reason. You're not finding anything. So, yeah, let's start with us. If we start with us, we shall understand the effects, and then we can advise our children better. And I am going to say, give your child a phone. That's okay. But then tell your child how they're supposed to use the phone. Because some of them said, this is for educational purposes, and that is true. They may find certain things that are not in the textbook. But when you give your child a phone, what does it mean? I'm sure if you say it today, tomorrow, the other day, the child will understand. So let's pay attention. It's not a matter of handing over a gadget, it's how to help a child use that gadget responsibly. And sensitization, I cannot talk more about. I don't know how long I can take talking about that. Because people don't know. Some people don't know. They think it's okay. They think a child is okay. Some even give to the young children, kindergarten, tablets, go and play. That's not what children are supposed to be doing. So we need to do more research like this. Dr. Kamisa, have you published this work yet?
It's under review at Discover Psychology. I'm sure it will be out in a month's time. Then we have about 3 more manuscripts that we shall be submitting to the journal by April.
And that's wonderful, because at least people who access scientific literature are going to read about that. But then we have people who are not into, scientific research, academic research. How do we get to those? I think is a question I'm asking all of us. How can we get to the general population that is not accessing this information? I think that's something we need to start working on, because people don't know and others don't care. But if we say it here, we say it there, we say it several times, someone is going to pay attention. And I'm going to say, you don't have to take away the phone. I tell, my children are a little old, I tell my children, the phones are there, but you have a life to live. So you can use the phone, but how about your life? So they learn from an early age that I have a phone, it's a gadget that I can use to call someone and I put it aside. It's not something I'm going to spend my time on. So give your children phones, let them access internet. Tell them that the internet is there, social media exists, but what is your life about? What are you going to do with your life beyond these things? And I think by starting from that, the child needs to understand that as like something, I eat food. Do I eat to burst? No, I eat to survive. So what am I using the social media and the phone for? So children begin by learning like that. That helps them regulate the use and, excuse me, that helps them regulate the use, but also understanding the dangers of excessive internet use. Yes, so I want all of us to work together to make sure everybody gets to know this information. The phone is not a gadget to play with, because that's what parents do. Child is crying, oh, some cartoons, you can have a phone. But beyond the cartoons, what is the child accessing? You get it? Yeah, so that's something we need to think about. But I'll just conclude by thanking Dr. Kamisi and team for the work well done. This is, we talk about it, but we had not got deeper into publishing this. And at least this is a step forward. But what happened that published work is for us in academia. The other people are not seeing these publications. So how about we do talks out there to tell the regular people who are not in academia to understand this? And I think we can do that. And the more we say, the more people learn, the more people pay attention, and the more they be careful. Thank you so much. Yeah.
Thank you so much, Dr. Asaba. That was so elaborate. It has really opened our minds to get to think about so many critical things, especially regarding addiction. Children get addicted as we keep giving them our phones to maybe babysit them. I was shocked that there is a little girl who is hardly even 1 year, but she has a tablet in one of the homes here in Kampala. Yeah, this one is hardly 1 year, but she has a tablet. So how that child grow up, as they grow up, they are going to be really addicted. And then I was in one meeting where a little girl kept moving on different tables asking for phone from different people. Can I have your phone? Does your phone have games? Everyone, it's like she didn't give up, and we know it. We just saw her in a corner busy on games. So children are very any initiative to protect them or to teach them about how they can be safe online, they will still make sure that they access what they are looking for. So it's an urge to all of us to really take caution and protect children. Now I want to open it up for discussion from the audience. We have heard from Dr. Kamisi. We have also heard from Dr. Ashaba. So now I want to maybe 3 people to come in and share their reflections and any comments on the presentation before we move on to those which are already in the chat. Any hands that are out there? Anyone who would like to comment or share any reflection? Okay.
Hello.
Yes,
Am I being heard?
Mr. Isaac Mukisa, please go ahead and make your submission.
Sorry, I don't know what's wrong with my camera, but I'll just go on.
Yes,
my name is
at least we can hear you.
My name is Isaac Mukisa, and I am a co-founder of the Rimland Generation and founder of Fathers Arise. I'm so glad to be here. Thank you so much, AfriChild, for this initiative. And I really am so passionate about this specific topic. Sorry, I came in late. My submission is while you're sharing, I'd like to tell you about a solution that is out there and that we are representing here in Africa. There's a UK company that has come up with a solution to address this issue. It's called HarmBlock. And it's an on-device safety technology that is designed to protect children from harmful online imagery. So it uses an AI built directly into the device operating system. So in case the kid is tech-savvy, they don't have an option to remove the software from the phone because it comes embedded in the phone. It works with the camera, both the hind and the front camera. In case anyone wanted them to take explicit pictures of themselves, they cannot access. The camera turns black whenever they faces something that is explicit in form of features. They can't go on certain sites that would be to display wrong imagery in before they are on the phone. So also something that parents can do is that the parent is given parental control on the kid's phone in the way that there's an application you load on your phone and it helps you to access the interface of your child's phone. It comes like any other phone. It has everything on it, but the difference is that the child is safe using it. So that because the parent accesses the interface, you have the liberty of removing any application you don't want your child to access remotely. You just remove what you want. If you think they can grow into YouTube, you put back the YouTube. If you don't want YouTube on, you remove it. If you don't want TikTok on, you remove it. Whatever software that is on or application is on their on their phone, you can easily access and remove it. You can also limit screen time. You can say that I want them to use the screen from this time to this time. It also helps to help you identify where they are located, how far the phone has gone. If you can say if it goes beyond 1 kilometer from maybe their home or school,
Thank you so much, Mr. Mukisa, for sharing. I request that if you have any details about that application, you could share them in the chat such that people can go and get acclimatized with it. Maybe it's one way that they can now start using to protect their children. Thank you so much. Naomi, your hand is up. Please go ahead and make your submission. Naomi, we are waiting to hear from you. Maybe as she gets ready, we can hear from Christine. Yes, Christine, can you make your submission?
Yeah, hello. Thank you very much, Dr. Kamisi and Maria, for this very important session. I just wanted to say that children are innocent and it's us who have them. So we really have to be intentional about their use of gadgets, but also to remind ourselves that we are letting them down when we do not choose to firmly help them make the best of what is available in our homes and environment. And I think that there's need for parents and other caretakers to be intentional about speaking to the children candidly, but again, of course, bearing in mind that you have to be aware of the age groups. So the younger they are, the fact that they can watch something, something on YouTube and keep it and learn it, it means that they can also learn some other things. So we have to sit down. I think the message should first go to the parents, to the caretakers. It is us providing these gadgets, but remember, we are so interconnected, whether it's at church or in the communities where we live. We have fences and gates, but the children easily cross over to their neighbors than the parents do. So even if you take away the gadget from the child, he or she might get it from their neighbor's child. Which is why I think it's important to sit with children and tell them this is right, this is not right, this can wait until you're much older and you will understand. One of the things I try to do with the 7 and 10-year-olds in my house, my own children, I sit with them and read and tell them that, you see, this is what happens to you and to your brain when you spend more hours on the screen. So I have introduced what we call an imaginative hour. So in the evening, if the classwork is done, you're free to imagine what you can do, which is something that is away from any manner of screen. So you can draw, you can paint, you can get to the kitchen, maybe do something in the kitchen, or go to do something that allows you to imagine. So I see more drawings, I see more coming to the kitchen and picking something, a ball, or trying to cut a fruit or something like that. So I think the problem with us is we are inconsistent, and also we have lost ourselves. For instance, very many parents don't have enough focus on just sitting there and let their children talk and let them ask questions, because as you answer them, children, they want to look at you when they are talking. They want you to look at them. And so if you interview parents, many are guilty of children, us wanting to talk to them and they're on their phones actually. So we need to be intentional. The way we are intentional with our projects, with our farmlands, we need to remember, because we are letting down a generation. We are letting down a generation because we are not being intentional. And we want the modernity in our homes. So all our homes have Wi-Fi. We are the late ones, returning home late. We are not sitting. Even when we are eating, we also have our phones and we are checking and we are smiling on phones, and the children are missing out on quality contact, eyesight, contact, with the eye. You're not even watching them. You're not even, having time for them. So we really have to be intentional and do all the controls, but create more opportunities for them to see. And the children also need to see us work. And for us, we have also made them think that to work is to have a phone. To work is to be before a computer. So they need to see us do the very basic things within the home, the cooking, the washing, and engage them and involve them. Yeah, thank you very much.
Thank you so much, Dr. Christine, for sharing. I liked the one of us being consistent and the Imagine Hour that you have kind of created for your children. It's such an innovation, and I believe they are creating so many things during that hour. So thank you for sharing. There are quite a number of hands up. Let's hear from then Ibrahim, then following him, we shall move to the Q&A, and then we shall be able to also get other hands that are up. Ibrahim, please make your submission.
Oh, thank you so much. I hope you can hear me.
Yes, please make it brief such that we are able to hear from everyone.
I really thank this opportunity given to me and Dr. Kamisi, my lecturer. Thank you for this research, and Claire, the moderator. First of all, I would like to share that as parents, we need to be intentional on parenting. That is our biggest gap that is bringing all this. The technology is supposed to support us as parents, not to lead us. And you find that there is no social media fasting anymore. Everyone uses, as parents, we have children, we have no attention to them, we have no budget of our time for our children. And these gaps are transiting into, now the combination of AI is amplifying everything and the effect. And to mention that even parents are mentally not okay, they need guidance, because as parents, you find others who are not even bothered. And I would like to bring parents who are on this platform and who are listening, that if you can get some time and read the book by Dr. Kevin Lehman. He gives us a guideline on how to raise a successful kid and how to deal with the internet as well, because we need attention budgeted for our children so that we can guide them to have meaningful conversations. The previous speaker talked about the imagination hour, to allow them to use their mental faculties in reasoning, critical thinking, and all that. But if we leave it to AI, if we leave it to the machines, to the computers, to to whatever as an excuse, at the end of the day, we shall end up with excusitis disease in our home, and we'll have no generation that is coming after us. So my recommendation or my suggestion would be that let us try to introduce social media fasting to our children, put away the gadgets. If it's time for our meals,
Fasting.
yeah, social media fasting is very important. Let's eliminate phones as parents when we are talking to our children, because we are models. They are seeing how we are doing it, and they are doing it. Yeah, you're on the dining, but the first thing is your phone on the dining, not the plate, not the conversation. It is the phone, and then before they bring the
Ibrahim.
food. Yeah, yeah, sure. So that is my submission, if I may wind up. Thank you so much for the opportunity.
Okay. Thank you, Ibrahim. So parents should do it properly. Make it brief, such that we are also able to get to the chat. There were interesting comments there as well. Emmanuel. If he's not yet ready, we can hear from Richard. Emmanuel, are you ready? Okay. Let's first run to the chat as we wait for them to make their submission. So in the chat, I want to first number of comments there. There are comments related to us sharing the presentation. This will be shared with all of you, as well as the recording. Our comms team will be sharing the presentation. I'm going to focus more on the comments that are related to the webinar. For those who are inquiring about any opportunities at AfriChild, kindly follow our social media. Usually these opportunities are advertised, and you can also walk in at AfriChild and make inquiries about all those possibilities. Yeah, I see Sisi Namatovu saying that she agrees. She said, I agree, most children access phones and internet with their mothers. So she's basically validating this finding and confirming it. There is so many applauds for Dr. Kamisi for the presentation. And Claire Charisima says boys have been given less attention. It's mostly the girl child is cared about. So it's high time to consider everyone, children. They are all children, not only girls, or even the boys. Still, Rogers is appreciating the wonderful presentation. Same Judna Matovu. Many of the people are really appreciating you, Dr. Kamisi, for the presentation. But Sisi is shocked that children in primary schools do own phones. Yes, Sisi, children actually own phones, even those that have not reached primary school currently. Even babies sometimes have phones. Still, someone is applauding you, Dr. Kamisi, for the presentation. Mutoni Apofia says, I think restricting children on what they watch is important, and close watching them as parents stroke guardians. I think it speaks to what Ibrahim mentioned, that parents should do their role of parenting and be there for these children. And also check even our addiction as adults, if we are also probably addicted to our phones, how much more can we help the children? I think it has to start with us. There were some challenges that the team experienced at some point. I apologize for that, for those network glitches. bullying and unrealistic comparisons, hence the depression. So it's kind of validating the findings that actually internet usage has a negative effect on children. And Frederick says there is a lot of action, making them have less time for better things. So children are addicted, and instead of them focusing on important things, maybe they are focusing on internet. Moses says, what do parents intend as they provide these gadgets to children? Do parents actually perceive the dangerousness of this in the long term? Very important topic. Thank you, Africhard, for organizing this. Yes, so is appreciating Africhild, but also raising some kind of question for us to reflect on. What do parents intend as they provide these gadgets? Do they know the long-term effects? I think this may be speaking into the need for us to disseminate this study widely, such that people are able to appreciate what actually happens in the long run, what happens when children access internet, what good things happen, what bad things happen, but how can we protect children, especially in this era where even AI is also now taking its trend. And then Mr. Mukisa shared with us the application in the chat, and I think he also elaborated more about it. Sarah Walusimbi says it's very bad that parents deny children of their childhood when they let them engage into adult dealings. Yes, children have a right to their childhood. Let's not deny it to them. Let's parent them very well and protect them from harm, even internet harm. If we can use those gadgets which are being, maybe that app that Mr. Mukisa shared, it's one way to still protect children, or adopting what Dr. Christine said about the imagination hour, all these mechanisms that we can use. Frederick says, true, children have less sleep at night, spending much time on net, because their parents can't control and monitor them on internet. Interesting findings, that's from Christabella. And Frederick goes ahead to say that parents should lead as examples while at home on phones, but at office, it's okay anytime they feel according. Parents should lead as examples while at home on phones, but at office, it's okay anytime they feel according to their right time management. Okay, thank you, Frederick. So it's basically saying that parents should be the lead examples. If we are ever on our phones at home, what are the children also learning? And Moses says, I wonder how schools can help, because our children spend a lot of time in school. Maybe it speaks to how can we engage schools. Maybe we can disseminate this study further in the schools, Dr. Kamisi and team. And yeah, maybe that's something that we can still do further. Alexandria says, indeed, the study is an eye-opener, especially to a boy child. They become addicted to games. They withdraw from real-life relationships become secretive. We need to protect the children. Yeah, she's confirming the need to protect children. And also validating. Brenda says the generation has changed. As mothers, we have left our responsibility to house helpers. We are never at home and we come back so tired. Therefore, children get parented by phones. So children are being parented by phones currently. And Claire is appreciating Dr. Ashaba for the insightful talk. Yes, thank you, Claire. Anthony Subuga says, if only parents could introduce physical and educative items, puzzles, painting books, board games, among others, instead of providing addictive gadgets with internet access on them, like basically introducing junior literature. Those are some of the solutions that we have out there. Thank you, Anthony, for sharing that. Ibrahim says parents also have mental health issues and phone addiction role. So parents are also addicted. Maybe we need to, first of all, support the parents before we go to support children. So it's an issue that is cutting across. Yeah, maybe we can embrace social media fasting. I know the fasting period is ending for the Christians, but you can carry it on. Okay. Parenting has gone wrong due to social media addictions. Parents should live exemplary lives. That's Christabella Adong. Then Richard Atwaire says, Dr. Asaba raised something very important. How often are we in a meeting and we pick our phones? It should be the start. It should be, maybe it should start with us. Yes. Thank you, Richard. We all need to check ourselves before we, and see how we are also using internet and maybe how it's affecting us. Maybe then we can be able to see how to protect children. People are appreciating the presentation. And there is a question for Mr. Mukasa. Isaac Mukisa, please, may you share with us the name of the solution app, please? That's one of our mentors on this program, Dr. Odama, who is asking. Frederick is also appreciating that innovation by the UK AI company, and they're asking how can it be accessed. And still even people are asking about the accessibility of this app. And I know you have come in to really share more information about it in the chat. There are quite a number of recommendations. Another is for parents should spend more time with their children and build strong bonds and guidance instead of internet all the time. So there are quite a number of mechanisms that can be picked on by all of us who are attending. Even if you are not a parent yet, you can still support children in your neighborhood or support your friends who are parents to see that the children are protected. Gertrude is appreciating the presentation and says, we adults also have addiction. Quite a number of comments in the chat, but since our time is really running out, I want to appreciate you for your active participation and sharing all this feedback with us in the chat. I want us to now move into the closure for the webinar. But before the closure, I also want to mention that as part of this program, one of the universities, Gulu University, we had a webinar last month where they presented to us the Total Safe app. And it's actually designed by the local people here in Uganda. It's an app that Gulu University designed to protect children online. So this app is currently being finalized and to get that job to be kind of sharing up widely. It's also a gadget that you can use going forward. So maybe you just be nominating it further. It's a locally made app from Uganda and developed by Gulu University, still under this program. Active participation in this webinar and for all the insightful comments that you have made. Let's check ourselves as parents. Let's protect children, even in our neighborhood, in our community, in the future. So in terms of next steps, we shall be sharing the presentation with you and the app from the Gulu team once it's ready. We shall also be sharing it. And we shall also be sharing and inviting you to join us for the next webinar. We have webinars that are lined up for each month. So be on the lookout and invite other people to also join us. Thank you so much for your time. Thank you to the presenters, Dr. Kamisi and Dr. Ashaba. God bless you all.
Thank you too. Bye.
Bye.